Hi, my name is Michael Ann Harbin. I am a registered nurse and a family nurse practitioner student at Auburn University. This is my presentation on the opioid epidemic for health policy. This presentation is geared toward healthcare providers, students, and patients who may be experiencing an opiate addiction. More than 130 people die every day from an opiate overdose. Deaths related to accidental opioid overdose have risen 4,250% from 1979 to 2015. In the 1990s, pharmaceutical companies were pushing opiates as a first-line treatment for chronic non-cancer pain. They were urging healthcare providers to prescribe opiates first. Purdue Pharmaceuticals was one of those companies marketing their drug Oxycontin this way. They failed to ever address the addictive risk of Oxycontin. Purdue would later go on to pay over $600 million in damages because of this. The opiate addiction and the epidemic in the U.S. has a profound effect on our community. The number of pregnant women who are abusing opioid medication has increased fivefold from just 2000 to 2009. Their babies are subsequently born with an opiate addiction also. They are diagnosed with neonatal abstinence syndrome. This can cause developmental delays and learning disabilities for these kids. Approximately 8 million children live with at least one adult who suffers from a substance abuse disorder, and parents with a substance use disorder are 3 times more likely to sexually and physically abuse their children. Healthcare providers are one of the stakeholders in this opiate epidemic right now. There are 5 key areas that they should be educated in: patient screening, appropriate prescribing, patient education regarding alternative or adjunct therapies like cognitive behavioral therapy or exercise meditation, the validity of Narcan and medication-assisted treatments like with methadone or Subutex, and then also discussing the stigma and the bias related to opiate addiction. Equipping healthcare providers this way allows for effective treatment and the appropriate follow-up care. So some implications for the nurse practitioner. The use of Subutex has been associated with a decrease in illegal opioid use and opioid overdose casualties. Laws limit the number of patients that a prescriber is able to write Subutex prescriptions for. So because of this, more providers are needed to meet the demand for the opiate addiction that we're facing. We also need to expand the education to the NP regarding Subutex administration. You must become certified in order to prescribe Subutex. Their course is online. I believe it's just a 24-hour course, and I even think that it's free. We also need to work on the expansion of prescriptive authority for the NP in the U.S. Some resolutions: identifying new effective treatment approaches against those currently in use. What are we doing versus what could we be doing better? What works better? We also need to identify certain pain interventions that are most effective for certain types of pain. Your chronic low back pain patient may require a different intervention than your chronic neck pain patient. In an effort to reduce the stigma and eliminate some barriers for these patients, we could even perform HIV testing at pharmacies rather than only at a doctor's office. These patients have a greater likelihood of recovery if we can eliminate the barriers and reduce some of the stigma attached to this. So in conclusion, the opioid epidemic is a public health emergency in the U.S. right now. It is important for us as healthcare providers to understand and utilize alternative therapies for chronic pain management. Nurse practitioners are positioned to make an impact due to the restrictive laws that govern the prescription of Subutex and the number of patients that are allowed per provider. As the demand for Subutex increases, more providers are going to be needed. Also, bridging the gap between efficacy and effectiveness research is critical in the implementation of empirically validated pain treatments, which will ultimately lead to a decrease in opioid addictions. my references for you. And that is all. Thank you so much for watching.